The Diabetes Center is designed to offer services including eye and cardiovascular screening, diabetic wound care, radiology services, dietary counseling, mental health counseling, and physiotherapy and rehabilitation services. Speaking at the opening ceremony, Minister of Health Dr. Frank Anthony said currently the prevalence of diabetes in Guyana is relatively high, with some 50,000 people living with the disease. As such, Dr. Anthony said there is need for a primary healthcare system so that persons can be diagnosed in a better way and they can get into the habit of having preventative checkups. The health minister further noted that it is the ministry's intention to have the system replicated throughout the country.
So if people start doing preventative checkups, then we'll be able to identify things very early and we'll be able to prevent or delay the onset of a lot of chronic diseases.
Meanwhile, in his remarks, Pan American Health Organization, World Health Organization representative to Guyana, Dr. Luis Codina, said in the Americas some 20 to 22 deaths per 100 population are attributed to diabetes. He noted that the management of diabetes is costly since it requires special care and insulin. And while education is important, he said prevention and management of complications is critical.
It's a public health problem in the sub-region. The treatment and the management of the complication is critical in terms to reduce the mortality, of course, and also the charge of morbidity, very complicated.
According to family medicine specialist Dr. Indira Budge, diabetes care is complex. She said over the years, Guyana has achieved much in terms of specialized diabetes care. However, Dr. Budge noted that primary care practices have not evolved accordingly. To this end, she noted an urgent shift is required in the way primary health care is delivered.
Diabetes care revolves around goal setting and achieving targets. This requires a shift in perspective by patients, but most importantly, by practitioners. And therefore, this scope of care is very broad. It is one of those conditions that requires an informed care team, an educated client, and the support of the community.
Apart from the services provided, the center will also serve as a hub for continuous training for physicians and healthcare workers across the country in proper diabetes care. It will also support laboratory testing of all health facilities on the East Coast corridor. Reporting for the newsroom, Sharda Bacchus.